Welcome everybody. Thank you so much for being here for CCST's Expert Briefing on Pathways for a More Smoke Resilient California, which we are very pleased to be presenting in partnership with the Office of Senator Alvarado-Gil. My name is Brie, Lindsey. I'm the Director of Science Services at the California Council on Science and Technology. And I want to say that CCST values the many perspectives and sometimes painful experiences that bring us to the knowledge that we hold and share. So especially for today's conversation, I'd like to begin by acknowledging that California Native American tribes and people have taken care of the land and waters that we call the state of California now since time immemorial. We have a lot of work to do to make meaningful reparative change to address historical wrongs that have been committed against California Native Americans. And I encourage all of us as we're engaging in this conversation today, and as we're going out into the world, to elevate tribal governments, communities, people, and priorities in all of our work. This briefing is the last in a series of events that have made up this year's CCST's S&T Week, Science and Technology Week, and we're so grateful that you're all here with us today to help us celebrate more than 35 years of making California's policies stronger with science and technology. And it's impossible to create science-informed technology without being able to rely on access to a strong network of technical experts that encompass a spectrum of perspectives and experience. So CCST was established at the request of the state legislature as a nonpartisan nonprofit to connect such a network so we can help provide streamlined access, synthesis, and translation of scientific and technical advice for our state policymakers. The core of that network is our formal partners. We have partnerships with the University of California, the California State University System, the California Community Colleges, Caltech, Stanford, USC, and California-located NASA and DOE, federal laboratories and research centers. We're very grateful to have experts from some of these institutions joining us today. In 2020, CCST began to focus our efforts on California's resilience to the many complex and cascading disasters that our state faces today and will continue to face in the future. Through our Disaster Resilience Initiative, we aim to deliver science and technology advice to reduce harm and improve the lives of all Californians. A resilient California prepares early for, responds swiftly to, and recovers well from natural and man-made challenges, which is a charge that really requires us all to think expansively about the resources that we have to alert us, assist us, and especially to help us learn so that we are able to strengthen and improve systems that may be disrupted during these disasters. Today's conversation will focus on opportunities to build pathways between forest management and public health to make California's communities more smoke resilient. Very pleased to introduce our moderator, Dr. Talhelm, Assistant Deputy Director of Climate and Energy at CAL FIRE. Alan has years of experience working in public service to implement policy and technical solutions to create more resilient ecosystems and support communities. At CAL FIRE, he leads programs focused on improving forest health to help address issues including climate change and wildfire smoke at the landscape scale. Alan has also worked on wildfire, smoke, and air quality in his previous positions as an air pollution specialist at CARB and as an honoris fellow with the US EPA. Alan, thank you for being here and for moderating this discussion.
Thank you for that introduction. I want to start out by giving some context for our conversation today. Fire has been a part of California's landscape for millennia. Research indicates that prior to European American settlement, about 4 million acres per year burned in California. For context, back in 2020 when we had a record-breaking catastrophic wildfire season, that was 4.3 million acres that burned in that year. Much of this wildfire in pre-Euro-American settlement times was generated by indigenous tribes who use fire for many purposes, including to generate smoke for a variety of cultural needs. Over the past decade, California has experienced unprecedented wildfire activity. These fires frequently blanketed much of California in smoke, and climate change is expected to increase wildfire activity, which could lead to a very smoky future here in California. Exposure to wildland fire smoke adversely impacts human health by increasing the risk of respiratory, cardiovascular, and other adverse health outcomes. Given those impacts, I was really excited to see the publication last fall of CCST's report titled "The Human Health Benefits of Improving Forest Health in California." The study found a growing body of research suggesting that forest management to improve forest health can be tailored to reverse the adverse impacts of smoke and benefit human health. Even when improving health means more beneficial fire, or putting fire on the landscape, this is a potential source of smoke that can have long-term benefits for human health. Through interviews, another critical finding from CCST's study was that human health sector organizations see value in engagement with forest management to help mitigate the harms of wildfire smoke. But they require avenues for collaboration and more information on potential benefits of forest health to human health. Today we're going to hear from our expert panelists. I'm really excited for this conversation based on the pre-meetings we've had and just getting to know everyone. We're going to hear them talk about connections between public health and forest management with the goal of making California's communities more smoke resilient. Before we jump into the conversation, I also want to point out there's been an important regulatory change in this area. Yesterday, the US EPA lowered the standard for PM 2.5, the standard from 12 micrograms per cubic meter to 9 micrograms per cubic meter. So that's going to have an impact on putting fire on the ground. We'll see what exactly that will look like in time, but that's important context for the discussion that we'll be having today. So with that, I'm going to ask the panelists to introduce themselves and also describe a little bit about how smoke has been impacting the communities that they work with and live in. I'm going to first start with Kerri Vera, who is the Director of Department of Environmental Protection for the Tule River Tribe.
Hey, thanks, Matt. Good morning, everyone. Good afternoon, I guess now. My name is Kerri Vera. I'm from the Tule River Tribe. I'm a tribal member, but I'm also the Director of the Department of Environmental Protection. At Tule River, we've experienced smoke impacts heavily, and I want to qualify that it's been from catastrophic fire, not the beneficial fire that we will also talk about here, or the prescribed burns. So our impact has been from catastrophic fires that come from many reasons and causes many impacts, but from not tending the forest, not doing fuels management. Tule River Tribe does heavily, we are heavily involved in fuels management. We have about 56,000 acres in the Sierra Nevada mountains and then into the foothills. It encompasses from the higher elevations about 7,000 down to 900 feet of elevation, and the community exists at the bottom of that. So in this river canyon, we're surrounded on 3/4 of our boundary by the Giant Sequoia National Monument that's managed by the Forest Service. So where the tribe does do fuels management, the Giant Sequoia National Monument manages very differently and has not been able to engage in that type of work. So if we've got wildfires on our land, we have about 7,000 or more acres of conifer forest in our high elevations that we manage, but that goes into the Forest Service land as well. And so if there's wildfire on their land, we're very heavily impacted. Sometimes it jumps the boundary, which it did in 2017, and that was our first very big catastrophic fire, of course, following the drought years as well. So that, and then I kind of say that we have our own airshed. Since the community's in the river canyon, the smoke comes and settles right in that canyon, right where our community is. And then as well as we are in the San Joaquin Valley, which is a huge bowl, and we get the impacts of smoke from other places. This last summer we got impacts of smoke from the Northern California fires, believe it or not, that came in and settled in the San Joaquin Valley and in our area. So I'll stop there, and I know we're going to talk more. I don't want to go over my 2 minutes, so thank you for listening.
I was just going to ask you, Kerri, could you talk a little bit about some of the smoke impacts in your community in terms of human health?
Oh, sure, yeah. So Yeah, so it definitely, there's the smoke impacts where folks are coughing and their eyes are burning and all those things, and we're in the smoky tribal community that's the closest town is 20 minutes away, so people aren't leaving, they don't want to leave. We've tried to do clean air stations and such things, but most of the houses there are cooled by swamp coolers, and obviously the fire season's in the heat of the season, so that has not been good for the tribe, and then community members don't want to leave. And just to add to that, so we've been working with our public health advisor or authority, I think his title is, he's been tracking COVID very tightly, as everybody has, but we were also tracking air quality, and so we saw a surge in COVID just in 21 when we had our last catastrophic fire. So that's just one thing, COVID, but there's also those other things that Matt mentioned, respiratory activity. That just happened to be what we were tracking at the time, and we were able to see that correlation. So.
Thanks, Kerri. Next, I'm going to turn to Deniss Martinez, so Dr. Deniss Martinez, who's a research administrator for Native American Studies at UCAS.
Hi, everyone. Like Alan said, my name is Deniss Martinez, and I have been really lucky over the past 8 or 9 years to work with cultural fire practitioners in California. I've gotten to experience the full range from being a tech on the ground with the Karuk tribe to getting to do my own research on how to best support cultural fire practitioners throughout the state. And so I come here to show what I learned, and I'm glad that Kerri is here as well. I think that there's a lot that we can learn from cultural fire practitioners about stewardship and about smoke. In terms of how smoke has impacted my community, I guess I'll approach that broadly because community can mean a lot of different things. But I've been really lucky to participate in cultural burns where smoke was used as a tool. Smoke can be really beneficial for certain species to manage pests. And so I've been really lucky to be able to see that, and it's been really healing because I grew up in Siskiyou County in a rural area surrounded by forest, and when these big wildfires came through, we really felt the impacts. My dad works outside, he works on a ranch, and so he's really impacted when it's smoky. I have other families that are farm workers, and they're impacted as well. And so there's definitely the negative side, and I've seen that too, but it's really healing to see how smoke was used as a tool and how we can work with fire to improve human health outcomes and outcomes for the ecology of our state.
Thank you. Next, I'm turning to Matt Wolff, who's the Climate Health Program Manager at the San Francisco Department of Public Health.
Hey, thank you so much, and thanks to CCST for having us here. Like Alan said, I am Matt Wolff. I manage the Climate Health Program with the San Francisco Department of Public Health. And being San Francisco, we're going to offer a little bit of a different perspective. We're a very urban environment, so we have less wildland interface than a lot of the other panelists up here. So the Climate Health Program, we're funded by the CDC. We're one of only 2 local health departments to receive Brie's funding through their Climate Resilient States and Cities initiative. And we kind of act as a bridge, so we bring climate knowledge to adapt public health programs and services, whether that's our environmental health inspections or our emergency preparedness and response or our clinical services. But we also represent the Department of Public Health at citywide initiatives. Increasingly, a lot of work is, they didn't design cities with climate change in mind. So the ways you address wildfire smoke might include home weatherization, and it might include emergency preparedness and response, it might include green infrastructure, and all of those are managed by different city departments. And so we bring a health equity perspective to these processes. And I think it's really important to bring a health perspective because we can center it around health data and epidemiology, so we can target programs to the people that have the greatest health impacts. We're our first point of contact to many of the vulnerable, most vulnerable people through our asthma services, so we can refer them to weatherization. We can build those connections. So how have San Francisco been impacted by wildfire smoke? We tend to be impacted primarily during the Diablo wind events, which happen in usually in mid to late fall. A lot of our epidemiology that we had was from the Butte County wildfire, where the AQI in San Francisco, I think, was unhealthy for 15 straight days. And we did surveillance tracking during that event, and hospitalizations and ER visits were slightly elevated, but I think one of the things is that everybody kind of suffered through it to a level that didn't require hospitalization in the short term, but was really impactful. So that includes, like Alan was saying, like, both coughs and headaches and itchy eyes and lethargy, but also major mental health impacts. And I think the last piece is that when they shut down schools or they shut down work, that has major cascading impacts on equity, especially for people that work outside the home or don't have alternative care for their kids. And we kind of view health impacts under a framework of exposure, sensitivity, and adaptive capacity. So exposure is the people who are most exposed to wildfire smoke. Like, we don't have a lot of air filtration in San Francisco. A lot of people live with air pollution every day if their housing is adjacent to freeways or industrial sources. Sensitivity is like your physiology, so people that are older adults, people with pre-existing health conditions, cardiovascular illness, and adaptive capacity is having access to the economic and social and political resources to prepare and respond. And so when we look at health impacts, which we do see from these events, it's usually we try to analyze it not only total, but like how it's affecting different populations.
Great, thanks, Matt. Last, I'm going to turn to Bethany from the Climate Wildfire Institute. Bethany is the Deputy Director for Operations and External Affairs.
Thank you. Really glad to be here today. I started my career as a wildland firefighter. I spent the better part of a decade working with the Forest Service and Bureau of Land Management as a hotshot. And that is not me bragging about being an exceptionally important person. Hotshots are a type of wildland firefighter. Through that career, and as I've continued down my path, I've put fire on the ground in every state west of the Rocky Mountains. I've worked in Florida, Alaska, Canada, and South Africa as well. Big proponent of prescribed burning, intentional fire, beneficial fire. I have a master's in wildland fire management and communications as well, and I've spent some time as a researcher in Spain looking at integrated fire management from the European context. So with my position with the Climate and Wildfire Institute, the Climate and Wildfire Institute is a boundary organization working between policy, research, and practice. And many of our projects are really pertinent to the discussion that we're having today. I think, from a practitioner standpoint, I'm sort of thinking about communities as communities of practice. So from a practitioner standpoint, practitioners are focused on implementation primarily, and most of them are suppressionists. So they're people whose jobs it is to put out fire, but I think many of them would tell you that there's a saying in the fire world that we're not putting fires out, we're putting them off. We live in fire-prone ecosystems that are dependent on fire, and it's important to sort of proactively put beneficial fire on the ground to offset the impacts from catastrophic wildfire. And so that has definite connections to the type of smoke that we're seeing. And so from that perspective, the long game from a firefighter perspective is that if we're going to reduce the impacts of smoke from catastrophic wildfire, we actually need to put more fire on the ground and with the right conditions, with the right smoke dispersal, and the right partners. And I also live smack in the middle of the Sierra Nevada mountains, and I can see the Caldor fire scar from every point on the property. And just from a community member perspective, I think the work that we're doing at the Climate and Wildfire Institute, kind of bridging boundaries between research, policy, and practice, every single one of those areas touch on communities, should be intersecting with communities and community members and people who are living in these fire-prone ecosystems have enormous knowledge when it comes to how smoke behaves in their local communities, and I think we can tap in from all of these communities and practice to that knowledge and really help turn the corner with these challenges.
Great, thanks. I think all of you now know why I'm excited to have this conversation with this set of people here. We're going to turn down just audience questions, so please raise your hand to ask questions to our panel, and also state your name and your affiliation. Before we turn to you, I'm going to start with one question, which is, how would you describe the work that you've been doing in your communities responding to wildfire smoke to reduce health impacts? Particularly, Kerri, it's going to turn to you first.
Yeah, I'll try to be quick. So we've been doing the best we can, I guess, is the short answer to that, and paying attention to the community and knowing that they don't want to leave, and so trying to get them to places where there's better air, like clean air stations, things like that. We've brought in temporary air monitoring stations to kind of get a handle. But more recently and more effectively, we were able to get some funding from EPA to do a very focused community air quality monitoring project, and with a focus on wildfire. And so it's kind of two-tiered. We are deploying air sensors throughout the community, inside and out, so collecting data. So that's not just, oh, it's bad out there, but actually really understanding the levels that we have and where, and then also reaching out and doing interviews and doing more of the social aspect of the community and trying to figure out how can we manage things better, how can we make our community safer. Our hope is to gather this data and get this idea of how we can get better that will lead to some more funding, so maybe we can do things like make the homes better, change out the filtration systems, because our community, like I said, is not leaving, they're staying, and we've saw that we've even offered to send them other places with better air, our elders, and they refuse to go, but really we're in the San Joaquin Valley, so I don't think it's there's nowhere better to go, sadly. So that's kind of what we're doing. We're excited about this project. We know the air quality is impaired, but gathering the data and actually having it and looking at it, I think is going to help us to kind of leverage our efforts to make mitigation, to mitigate some of the impairments.
Great. Deniss, do you want to talk about this as a creator of smoke and how you think about public health?
I think how I think public health, especially around cultural and beneficial fire, is that cultural fire is really about, bringing cultural foods, cultural materials, and cultural connection within communities, and kind of revitalizing and really bringing those things back to communities. So, I think that's a public health impact that's really important in this conversation. And certainly, I think Bethany might be able to talk about this more, but a lot of the cultural fires I've been on in California, which are mostly in Central California, and then up on the Klamath, have been low and moderate intensity. And so the smoke impacts from that kind of beneficial fire is just not the same as a wildfire. And in fact, it's a lot easier to manage. It's easier for communities to plan around them. So like Kerri was saying, you can talk to your elders, you can give them air purifiers, you can take them to clean air stations, you can give people a timeline, like we're gonna be burning from this time to this time, and you'll feel smoke impacts around from this time to this time. And that's just such a huge difference from a wildfire, right? When it's a wildfire and you're looking at smoke, not only are you potentially destroying a lot of cultural resources, but there's also just a lot of variability and a lot of unexpected points that make it really hard for us to tell communities this is when the smoke will end about. So that's one thing.
Absolutely.
And just to add on to what Deniss is saying about planned and cultural burns or prescribed burns or what have you, you can take into account what season and time of year to do it, what locations. The area that you're doing are very much smaller than we're talking about these tens of thousands of acres of catastrophic burn is way different than a cultural burn where you have, take all those things into consideration: culture, season, space, time, location, all of those things. So just making that difference.
Great, thanks for the commentary. Matt?
Sure. So San Francisco, I think, once again, has more urban. What have we been doing to respond to wildfire smoke events? I think a lot of my work, so I'm thinking about it in two sections. One is, what is the community doing, and what is the city doing often to support the community? And as the city, one of the things we've done is try to do better coordination between different sectors of the city. So I manage we call it the Heat and Air Quality Resilience Project, or HAQR Hacker, because we can't turn down a good acronym. And this is co-managed by the Department of Public Health and our Office of Resilience and Capital Planning. And the goal of this project is really to bring all the stakeholders together in San Francisco, city departments, but also community-based organizations and academic institutions, and come up with a plan for how we need to adapt to extreme heat and wildfire smoke events. And this includes everything from emergency preparedness and response actions to home weatherization to siting green infrastructure. And I think one of the real things that I sit on is that this is relatively new for public health departments and emergency response departments, where there's not that many times where you know that there's going to be more hazards 10 years from now than there is right now. So it's just as a organizational culture, we're adapting to long-range planning. Like oftentimes public health departments have 5-year plans and not 20-year plans. And we know that we're gonna have to scale services, or we know we're gonna have to build out a network of cooling centers or clean air centers, over the course of the next 10 years. And we have like the lowest rate of cooling anywhere and the ventilation anywhere in the country. And so it's like, how do we get our own libraries weatherized so they can support this effort? Our communities are reacting by just kind of, while we're in the planning space, they're just doing it in this really amazing way where they're supporting each other during wildfire smoke events. We have a lot of faith-based institutions or CBOs that open and operate as clean air centers. We have a lot of people that distribute masks or trainings or alerts and warnings. So I think there's both the short-term emergency response element to it, but then also long-term, how do we adapt to a city that's more resilient to wildfire smoke events?
Thanks, Matt. Bethany?
Yeah, I think there's a lot of pressure right now for California to increase the pace and scale of the treatment we're doing across our landscapes, whether it's prescribed or cultural burning or thinning or what have you. And when you think about that in terms of smoke, particularly with prescribed burning and cultural burning, the pressure to increase the pace and scale means that we have to absolutely optimize every single burn window that we have, and ideally we're creating infrastructure to extend those burn windows. And that comes right up to the air quality issues and regulations and all sorts of things. So it's incredibly nuanced. Climate and Wildfire Institute is working on a number of different initiatives with the California Wildfire Task Force that are building tools to be able to give decision makers the data that they need to make good decisions around increasing pace and scale. It's hard to understand how much we need to increase treatments if we don't actually know what's happening out on the ground. And so something like the Wildfire Landscape Treatment Tracking Database or Dashboard is a great tool to do that. When it comes to health impacts, I think having visibility on when fires are burning and how that smoke is going to impact communities is only going to support the decision making that comes into play when we're talking about policies to help support this increased pace and scale of treatments. And it's a little bit circular again, we're creating more smoke in some cases, but we just really need to utilize all aspects of these communities of practice to make these good decisions.
Great. Is there anyone from the audience who'd like to ask a question for the panel? All right. Feel free to jump in anytime, but in lieu of an audience question, I'm going to turn to the panel and ask. So we've just talked about your current responses. What would help you do better in terms of responding to smoke? Maybe I'll start with you, Matt, because I feel like you've got a lot of capacity now, and you've got the mentioned plans for the future.
Yeah, I think, when I think of what would help, I think there's a lot of things. I think one of them that I keep thinking about is around home weatherization and electrification and sealing building envelopes, and how do we make spaces that are adapted to wildfire smoke and heat. And, at the very granular level, it's like, how do we make sure that when, we're rehabbing a building in San Francisco, that we're weatherizing it, at the same time, and trying to make sure those pathways happen. I think information on health impacts is really important, and not only hospitalizations or mortality, but the harder to measure stuff. So how many asthma inhaler prescriptions are being filled right before events? How many? I think that would be really helpful as we try to design targeted interventions. And also, basically just better, at least in San Francisco, knowledge of what to do during wildfire smoke events. I think that this is still really new. I think it's scary. I think there's a lot of behavioral health, mental health impacts to having catastrophic wildfire smoke events. And I think just having better knowledge of the best practices. How do you, as I'm a renter, I don't know my landlord. I don't have the ability to advocate for a big building level intervention. What do I do during a wildfire smoke event? I think it's really important to have that messaging at different scales based on equity and access.
Kerri, I'm going to turn to you. I imagine things are somewhat similar, but also somewhat different.
Definitely, I echo everything that Matt's saying. So certainly, what we can do from leaders' point of view is to try and help our community weatherize and do better things for their homes. Sometimes, it takes money, so resources for that. But also, I think community outreach, education, and reaching out and letting them know, because it's kind of I don't know how else to say it, but it's kind of a silent killer. Some people think, oh, I'll just go in my house and close the door and I'm fine. Not realizing that's really not fine. I'm hearing it's in the walls, it's coming through the vents, so your community leaders might be able to help you, but maybe there's things that you can do yourself. If you can afford to buy better filters, or if you can afford to weatherize your home, if you have that understanding that'll help. But I think we got to get that understanding out there too. Like I said, outreach and let people know the impacts. Oh, obviously people coughing and their eyes burning, they understand it, but it's those of us who that's not happening, but that doesn't mean we're not being impacted. So that understanding, helping our communities understand the health impacts without creating panic, I think is a good effort as well.
As somebody who used to work at CARB and climate programs, I'm struck to hear about weatherization and that being a solution for smoke, and also being a climate solution as well. On this topic of how you can do things better enough, Deniss or Bethany, you have ideas for sort of the downstream or predictions or other tools you do think that would help you get more fire on the ground while also avoiding health impacts?
I think I don't know if I think maybe a tact I'll take is how we do things better, just from the leader's perspective, and also just from how to collaborate better. Public health agencies and organizations are really, really good at outreach and communications and engagement, and generally they are connected with local health organizations that are deeply connected in the communities, and I think land managers and fire managers need to tap into that to be able to convey to the public what tools are available, but also to help shift some thinking around what to expect in the shoulder seasons when we're doing more burning, and to communicate in a way and through an avenue that fire people aren't using right now, I think could be really powerful. A lot of fire communication that happens is incident communications, and we need to be a little bit more proactive, and I think that would help improve public health outcomes.
Do you want to add anything to this?
I guess I'll just add that the way that we currently view wildfires as an exceptional emergency event, but they're happening every year. And so as we start to measure the public health impacts, the ways that our communities are experiencing poor health outcomes because of smoke, I think it's important to see then that avoiding wildfire, kind of adding to the pile of evidence that avoiding wildfire, these large wildfires, and really being active with stewardship and management is more important than just, it's more important to all of us, right? As the evidence kind of stacks up, we have even more reason to go out and steward. So I guess just adding that and really seeing it as a part of California and the way that our landscapes work.
Question from the audience?
Yeah, I'd love to get the panel's reaction to the EPA's adjustment in the PM 2.5 standard. I was hearing this time last year a lot of concern that it could make it harder to do prescribed burns and commercial.
Can I ask you to identify yourself?
Yes, my name is Vera, and I'm a reporter from KQ.
Anyone want to go first?
I'll jump on this and also just preface by saying there's a lot of learning that I need to do around it, but I think ultimately when we talk about increasing the pace and scale of beneficial fire, we're going to have to do so without added layers of bureaucratic processes, and I think this new ruling is there isn't really a clear pathway on how we need to navigate through this. There's a lot of work I think that needs to be done to provide some clarification. I know that that the sort of expectation is that it's going to take longer for people to get burn permits, and that's going to be problematic when it comes to, again, the work that needs to happen on the ground. So it just happened yesterday, so there's a lot of thinking that needs to come into play, but it is worrisome.
I can see. So yeah, I can put fire on the ground. I'm not even a forester, but I share an office with one. I think I made a joke earlier when we were all talking that these catastrophic fires, they're not getting permits, they're in it non-attainment, right? But yet it's keeping these other beneficial practices from happening, so that's unfortunate. I think I guess we'll just see how it plays out. But I also wanted to add that in forest management, fire, even the good fire, that's one aspect of managing forests. That's one aspect of taking care of our forests. So there's so many other things that don't involve smoke that we also can take advantage of as well. So I think, but yeah, I guess
So I'll also add that, along with the change in the standard, it is going to be a change in the AQI and the AQI scale. I mean, Matt or Kerri, as people who are using that probably as a tool to protect public health, do you feel like that's going to change your work?
I'm going to plead a little ignorance, and I can talk about how we use the AQI scale now, but I'm not necessarily super aware how it's going to change the AQI scale.
It's going to mean less pollution is going to be higher AQI.
Higher AQI. Right now, we are activating at different emergency response thresholds based on the AQI scale, and I think And like all activations, it's like a delicate balance because you don't want to activate too much. In San Francisco, for example, and I'm going to use heat as an analogy because I'm more familiar with heat, that an extreme heat event officially in San Francisco is 85 degrees, which is very low. But if we send out alerts and we ramp up our activation every time it gets 85, the public takes it less seriously. So there's kind of a communications component of when we activate, when we start doing these emergency response actions, so they're taken seriously. At the same time, it's complicated because with AQI, our activation threshold is based on the AQI levels, but also, the duration which it's at the AQI level. So there's a lot, it's also very difficult because if it dips into unhealthy, but just for an hour, how long do we wait for it to be unhealthy? And so I'm not sure, I haven't worked through what the impact is that going to be. That's going to be upon our emergency response folks. But I do think that there is a constant balance when do we activate, when do we provide resources at which levels. And I would say that the weatherization conversation is kind of like how do we build for, a future where more people aren't exposed to the wildfire smoke events in the first place. So.
Anyone else on the panel want to add anything?
I'll just, echo what Bethany and Kerri said and say that any sort of added bureaucratic burden can really impact tribes that have less capacity. And those tribes are already pretty bureaucratically burdened. And so it's always a concern when that happens. We'll see how it plays out with this. I also, just happened yesterday. I'm also still thinking about it, but I think that's just something to note, is that there's an equity issue around who has capacity to put fire on the ground. And it's always a concern when this kind of thing happens.
Any other questions from the audience? I know some of you, and I know you're scientists, question askers, so don't be shy. There's one in the back.
Hi, I'm Serena Batal, I'm a CCST Science Fellow. I'm curious if you have examples of success stories of getting fire on the ground in a timely way that we could use as lessons learned for how we can do more of that, particularly in times when it's sort of ecologically logical. I mean, a lot of fire gets on the ground sometimes in the spring when the natural cycle would be more in the fall, and I'm just curious about what are things that you might have seen that you try to replicate or build into the process that is the bureaucratic process that might make this easier.
Deniss, I'm going to you first.
That's a really good question. I don't know that I have a 1, 2, 3 how-to for you, especially from, I work with tribes. Some tribes have this, a larger staff and infrastructure, and they can engage in more complex agreements with federal agencies. It also depends on where they want to burn, right? If you want to burn on public land, you have to negotiate with federal agencies. If you want to burn on fee or private land, it's a lot easier, and I think that's where tribes have found some success in bringing very cultural aspects, like including children or including community members. I think working with the federal government requires more capacity because often the federal government has higher requirements for people that are putting fire on the ground. And so there's a lot of complexity on the land. So when you look at a map, it really depends on where you're burning, are you of a tribal government that's federally recognized? Are you not federally recognized? Are you a tribal nonprofit? And so all of these things become variables. And so I find that what's been really, the folks that are really successful have support either from their own communities via funding and staff, or through partnership to figure out all of those different variables and how to put them together to put fire on the ground in a way that feels good to them. So yeah, that's a more complex answer maybe than you're looking for, but yeah.
Yes. To point to, there's a lot of really cool work that's happening on the ground. To point to some specific success stories, there's a program in the North Bay area called Fire Forward. So the Audubon Canyon Ranch, they're doing really great things with capacity building at a local level. Community-led prescribed prescribed burning associations are starting to pop up in communities all across the state. It's very exciting. There is a program called the Sierra Sequoia Burn Cooperative that we are working with on a project, and they're a partnership with local ranchers, I think 5 different tribes, and other sort of partners to increase capacity and to sort of integrate efforts across kind of community scales. We are putting together a burn right now on the Tea Kettle Experimental Forest, which is on the Sierra National Forest. It's a 3,300 acre burn in the largest contiguous stand of old growth outside of the park system. And it is flanked on either side by the Creek Fire and the Rough Fire that came within 15 miles. Those are both very large fires that burned in the last 10 years, I believe. It is, it is a precious ecosystem that we need to protect, and we need to protect it through burning. Otherwise, it will burn. It came close to burning, and to do that effectively, this is on federal land, but to do it effectively, it's going to require partnerships with a lot of different agencies, a lot of different community groups, and so we're looking at how we can take the lessons that we're learning as we're going through this process, and we're early in the process, we're in the NEPA stage. How can we take these lessons of working with these agencies and organizations and share those lessons with other organizations so that we can start doing large landscape level treatment like this and break down some barriers that sort of like extend the process over time in a way that it shouldn't necessarily mean if we were effectively collaborating and really increasing capacity of each partner. Does that make sense?
Yeah, I know it was like good perspective too, and I just wanted to add something. I mentioned the giant sequoia national monument that surrounds us, and their hands are tied, and I'm not trying to say anything negative here, but I've talked to some of the staff that wish they can do more to do fuels reduction, that wish they could do more management activity, and their hands are tied. And so if could be some wiggle room now, some understanding on some of these things, maybe we don't need to have our hands tied so much. The very things that they're trying to protect, very threatened, meaning that the groves and other resources were very threatened during these catastrophic fires that were a result of non-management. So I think there just needs to be that better understanding and a little bit more wiggle room, planned wiggle room.
Any other questions from the audience? Yes, go ahead.
Hi, Eric Davies. I'm also a CCST science fellow. So the history of fire suppression in California actually has led to an extreme overabundance of fuels, which basically each of us prescribe roads. But how does that overabundance of fuels complicate those prescribed roads themselves? If there's too much fuel and one of these roads gets out of control, that could lead to catastrophic wildfire. Can you guys talk a little bit about how those are planned for, or how to make the characteristics more favorable to more sustainable practices?
I'll let the panel talk in a second. One thing I want to note is, in my introduction, I observed that the archaeological data that we have indicates that there was, on average, 4 million acres per year of fire in California prior to American settlement. And I pointed out that was pretty similar to what we observed in 2020. But there's a big difference in those, and one of the key differences is the fuel load between 2020 and those these prior years. We are experiencing 4 million acres a year per fire in these pre-settlement conditions, but there wasn't 100 plus years of fuel accumulated during this period of time because there was so much on this fire. So yeah, we have a lot of debt to make up, and that can lead to a lot of smoke, a lot of those accumulated fuels, and there are other treatments that we can put on the ground in addition to fire to consume some of those things. But these practitioners know more than me about this. One of the things that can make smoke control tricky from a prescribed burn or a cultural burn is those large heavy fuels, like a down decaying log. Once that catches, that can smolder for a long time and can make it harder to time your smoke events and things like that. As we do more to restore our landscape, we're going to get rid of those types of fuels. It's going to get easier and easier to apply prescribed fire across the landscape. But until we get to that point, there are going to be these issues with these large smoldering fuels that are going to put off smoke for a long period of time. So with that, others want to jump in.
So I do know that there is some really good research that's happening right now as to whether we can put fire on the ground effectively to restore the landscape without pre-treating it, so without going in there, thinning, piling, that sort of thing, or if we need to treat at least the perimeter of prescribed burns. It's important to recognize that a lot of prescribed burns are done for hazard fuel reduction purposes solely, not necessarily for habitat restoration. And I think long-term what we need to be looking for is a stewardship model of managing the landscape. But right now we're in a mess, right? We recognize that we're in a mess, and it costs a lot of money to treat these lands, and you cannot just go in and burn 1 year and not expect to have a fuels accumulation after that. The fire regimes vary, but like where I'm living, 15 to 20 years is kind of the cycle that you would expect fire to go through, and it's been well over 100 since we've seen that. So I think in terms of best practices, we're learning, and not only are we learning how to deal with the accumulation of fuel, we're learning how to do it within the context of climate change and fire environments that we've never really seen before. So recognizing that there's a space for technology improvement, but there is a massive need for capacity from a boots on the ground kind of perspective, or boots on, can be from the air too in some cases, but I think there, like I said, there's a lot of work to be done there, but we need to get better at prioritizing where we're doing the work, and we need to get better at recognizing that we're going to have to go back in, and the very best way to go back in is using that stewardship model. That is how we're going to achieve resilience, and that's why supporting tribes and the efforts and providing resources to build capacity with the tribes is going to benefit us in the long run.
I just wanted to dovetail off of what Bethany said, and then maybe I know I haven't mentioned it enough, so I talked about catastrophic fire due to not doing fuels management, but we also had the drought. I mean, that was part of it. Part of why they were so catastrophic as well was because the forest was so dry from the drought, unusually dry at those fire seasons, and then we had huge kills from the beetles as well, and that was drought related. It really wasn't non-fuels management related. I mean, so that was part of it too, and I didn't want to just ignore that. So thanks for bringing that up, climate change as well.
Matt or Deniss, you want to add anything to that?
Can I add one more?
Yeah, absolutely.
Just one other thing to consider here is a lot of the thinking we're doing around prescribed burning and prescribed burning for hazard fuels reduction is going into areas that haven't seen fire in 100 years or plus. I think one thing that we're going to have to shift towards is looking at the areas that have burned recently, like we have the Dixie Fire that burned almost 1 million acres, and optimizing the fact that nature hit the reset button and going in and reintroducing fire into the areas that have burned recently to capitalize on the opportunity to as the forest is regenerating to help it along so that we don't see type conversion, so a forest to a brush fuel type, for example, but also just starting to socialize the idea of seeing fire back on the ground and that it doesn't necessarily mean catastrophic destruction.
I think our time is up. I was getting one more question? Okay, one more question.
Someone mentioned the exceptional events and the exceptional events rule. I'm wondering, as you guys think about the next 20 or 30 years of California's fire future, do you think that the ability of air districts to kind of subtract air pollution when they're not in attainment through that process is a big problem for communities breathing healthy air? And would you like to see those policies revisited? Does that make sense?
Does anyone else want to take that? No, go ahead.
I'll give it a try. So my understanding, and again, I have some learning to do in this area, the exceptional events rule, the idea is that we should be able to use it for prescribed burning. That prescribed burns are now an exceptional event, is that correct? I believe it's only been tried once, and it took 3 months to get through to that designation for a single burn. And so that's where, when I mentioned that there's bureaucratic processes that can extend the time frame for getting a permit, three months, you're missing huge burn windows. And so I think the agencies are going to have to identify how to actually work through that process. And I do hope that it's revisited at some point. If we don't do this work, we're going to have wildfires. It's again that sort of catch-22 circular kind of thinking. And I want our communities. I have lung issues. I want our communities to have clean air, and I appreciate that we're regulating and moving towards that. We're going to have to strike a balance, and I'm not sure how we're going to do that within the context of climate change unless we're really proactive about honing in on this prescribed burn smoke emissions issue.
Yeah, so the exceptional events is a designation that can be made after smoke or other pollution events impacts an air monitor that has a regulatory purpose. So it's a thing that if there's a prescribed burn, if there's a wildfire in interest, you can petition the US EPA to remove that from basically what counts for whether or not they're in attainment or not. So that's a process. It can take a long time. The burden in terms of data can be very hard and very high. It can be lengthy. I think air districts have limited capacity. Some of them are very small organizations in the state of California, and they may not want to go through this process. They may instead say, we just don't want to prevent your prescribed burn ahead of time. Another point I'll make is that an exceptional event, while it doesn't count for regulatory purposes, still counts for public health impacts. It doesn't get us out of those public health impacts. A larger point is that the Clean Air Act, as it was originally devised in the 1970s, was not really, they didn't really think about wildfire in the same way that we think about it now. The context for the amount of wildfire that activity that was happening in the 1970s was very different than it is now. Suppression was very effective at that point in time in our history. The amount of fuel accumulation was lower. And so it was not really a thing, I think, that was deeply considered back when the Clean Air Act was conceived, and this idea of putting fire on the same place as you would a volcanic eruption, for instance, or a dust storm, maybe it was not the best conceived. Because we certainly do have some degree of control about how much of our landscape is burning at any one particular point in time. We can, as I think Bethany said earlier, we're not putting fires out, we're putting fires off. And that I think has a lot of implications for the exceptional events rule and our air quality and our public health going forward. Now I think we're done. With that, I'm going to turn it back over to Brie.
I just want to say thank you so much to our moderator and our panelists for joining us today, and to Senator Alvarado-Gil's office for partnering with us. Huge thanks to for everybody who came out today, and anybody who joined us for any of our other FMC week events this week. It's been a really great week. If you would like to watch this briefing again, or if you know somebody who was hoping to make it today but couldn't, we've recorded it. It'll be posted to our website along with our one-pager that it will include contacts for the experts we've had today. Thank you so much, and hope you enjoy the rest of your day.